Heavy menstrual bleeding affects millions of women, but it can be a really tough thing to talk about. So today, we're going to pull back the curtain on one potential solution out there. It's a procedure called NovaSure. We're going to break down exactly what it is, how it works, and who it might be for. So, are heavy periods controlling your life? I mean, for millions of women, that's not just a hypothetical question. It's their reality. Heavy periods, the medical term is menorrhagia, can just totally disrupt your daily activities, your confidence, your whole quality of life. It's a really common problem, and that's exactly why it's so important to understand what solutions are out there. All right, so first things first, let's get really clear about the problem we're talking about here. We are focusing specifically on heavy bleeding that comes from benign causes. Benign just means non-cancerous. That's the specific condition that a procedure like NovaSure is designed to tackle. Okay, so if that's the problem, heavy bleeding from benign causes, then NovaSure is one of the potential solutions on the table. But what is it? What does it actually do? When you boil it all down, the goal of NovaSure is actually pretty simple. It's designed to remove the very tissue that you shed during a period. The uterine lining, or what doctors call the endometrium. And how does it do that? It uses a very precisely controlled form of radio frequency energy, and the whole thing is designed to be as quick and simple as possible. So who is a good candidate for this? Well, it's really designed for premenopausal women who are dealing with that heavy bleeding, and this is a big one, who are absolutely certain they are done having children. And trust me, we will come back to why that is so important later on. It's also often an option people look at when medications haven't really worked, and they're hoping to find something less invasive than a full hysterectomy. Okay, now here's the part that might really surprise you, the procedure itself. You might be picturing a long, complicated surgery, but NovaSure is actually known for being incredibly fast. So let's take a look at how it all goes down. And get this is probably the most stunning number of all. While the whole thing is fast, the actual treatment part, the moment the radiofrequency energy is doing its job, takes on average just 90 seconds. That's it, a minute and a half. So how does it work in those few minutes? It really breaks down into 4 simple steps. First, the doctor inserts a really slender wand. Then, from that wand, this soft, flexible net expands, and it's designed to fit the unique shape of your uterus. Then comes the main event, that quick 90-second delivery of radiofrequency energy. And after that, the net just retracts back into the wand, and the whole device is removed. Simple as that. So, all in all, from the moment it starts to the moment it ends, the whole procedure is typically over in about 5 minutes. Yeah, 5 minutes. It's so streamlined that it can often be done right there in your doctor's office. But, okay, what happens after those 5 minutes are up? Because, knowing how a procedure works is only half the story, right? What really matters is what comes next. What's the recovery like? And maybe most importantly, what are the results? And when we look at the results, the numbers are pretty compelling. Clinical studies have shown a really high patient satisfaction rate. We're talking about 9 out of 10 women saying they are satisfied with the outcome. That's pretty impressive. So what does satisfied even mean in this context? Well, for most women, it means their periods get dramatically lighter. For a lot of them, they become very light. And for some, periods just stop completely. The main goal here is a huge reduction in that heavy menstrual flow. And that whole theme of simplicity, it carries right over into the recovery. This isn't something with a long, drawn-out healing process. In fact, most women are back to their normal everyday activities within a day, the very next day. Now, during that short recovery period, there are a few things to expect. Some cramping is totally normal, kind of like regular period cramps. Your doctor is going to tell you to avoid using tampons and to hold off on sexual intercourse for about 4 weeks, just to give everything time to heal properly. And it's also pretty common to have some watery discharge or a bit of spotting for a little while. Okay, this brings us to what is probably the most important question of all. We've talked about what it is, how it works, but how do you know if it's the right choice for you and your situation? There's some really critical things to think about here. And I really want to pause right here for a second, because this is, without a doubt, the single most important thing to understand. This procedure permanently changes the lining of your uterus. Now, while getting pregnant after NovaSure isn't likely, it is still possible. And if it does happen, it is extremely dangerous, with very serious risks for both the mother and the fetus. So let me be absolutely crystal clear on this. This procedure is only for women who are sure, 100% positive, that they are done having children. Because of those risks we just mentioned, it is crucial, absolutely essential, that you continue to use a reliable form of birth control afterwards, even if your periods stop completely. It's also really helpful to see where NovaSure fits in with the other treatment options out there. You've got a pretty wide range. You've got hormonal options like IUDs or pills, which are reversible, but you have to keep up with them. Then you have the other end of the spectrum, a hysterectomy, which is permanent, but it's also major surgery. NovaSure kind of sits in this unique middle ground. It's minimally invasive, but the change it makes to your uterus is permanent. So what's the takeaway here? Well, the whole point of this explainer isn't to give you an answer. It's to give you the right questions to ask. So now, armed with all this info, you can go have a really confident, informed talk with your doctor. Because at the end of the day, the best choice is always going to be the one that lets you get back to living your life without your period being the one in charge.